everyone, and welcome to my channel. My name is Nikki, and I am starting this channel for anyone interested in learning about the cardiovascular system, mainly pertaining to ultrasound. I have been in the ultrasound field for about 13 years now, give or take. And I just felt compelled to try and kind of give back, because I mentor students, and some of them come in with a lot of questions, and sometimes you don't have time to answer it all, especially when you're trying to deal with a full patient load. So I decided to try and address certain things here. I just want to give a better insight, try and give a little bit more in-depth when it comes to scanning or circulatory system, stuff like that. So what I really want to start off with is more of kind of tips. First of all, the mindset that you want to have when you're in this field. You want to be, first and foremost, you need to have that passion and that drive. Like, you want to do your best with anything, but we are in a field where a lot is kind of dependent on you. You have to be able to work independently. You have to be able to identify certain pathologies, and you have to know when it's a good time to actually get a physician involved. So it's important. So you have to start off with, this is not a joke. You need to be passionate about what you do in anything. Another thing I would say is, don't be afraid to ask questions. It can be very intimidating at times. You might feel like, I don't know if I should really ask that. I don't know if it's gonna sound right. If it's a question, there's an answer. And if someone that you're asking the question to does not know the answer, more than likely they'll go try and figure it out and then get back to you. So don't be afraid to ask questions. And here, you can even ask questions here. If I don't know it, I will not give you a false answer. I will tell you I probably don't know, and I will try and figure it out for you. It's just what you do. If you have a question lingering inside of you, it's okay to ask it. What else? Another thing too, especially when it comes to scanning. Actually, a couple things when it comes to scanning, but first of all, it's okay to take your time, especially students. It is okay to take your time. I know kind of the feeling when you are in school, especially when you go on your externships or clinicals, and you see techs that can do scans a lot quicker than you can, and then you kind of feel some type of way. It's okay to take your time, because when you get the basics down and you use and you fine tune and you get your imaging down like on point, you get faster, you improve more, and when you have that quality, you can only improve from there. When it comes to like scan time, you want to get your quality. You get your quality in check, and then you worry about your speed. When it comes to scanning as well, okay, we'll talk about echo first. Echo, when it comes to scanning, well, with anything, but echo, you know how in echo you have your indicator marker, and you are supposed to have it at a certain angle so that you can get certain types of views. And yes, you need it for that reason, but don't get fixated on all that technical, it needs to be like 11 o'clock or any of that. You need it for placement, but then look at your screen. Your screen is what's going to guide you to get the best image that you can get. When you're driving a car, you don't look at the steering wheel when you're driving. You don't sit there and you go like this. You look where you're going, and your screen is going to direct you where you need to go. Trust that. What else? And that's for like any modality when it comes to carotids, when it comes to upper extremities, when it comes to lower extremities. Use your indicator marker for placement, but look at your screen to help guide you to get the best image that you can get. Because you gotta also remember that the doctor is interpreting things based off of the images that you give them. So you wanna give them the best quality images that you could possibly give them, right? What else? Oh, and let's talk about acquiring images. I've noticed this too, because I've had this issue. You might get a picture and then you lose it. Let's say you're doing an echo and you get a picture and you're like, oh my gosh, I finally got it. And you thought it took you forever to get it, and then you lose the image. Trust, if you found it once, you'll find it again, because you know it's there. You already found it, it's there. And you know everybody has a heart. It might be kind of difficult to find at a time because of intercostal spaces or lung interference or upper body habitus, whatever it may be. You can find it. It's there. It might not be the best image per se, but you can optimize that image to the best of your ability if you just take a little bit of time. That's why I kind of stress quality. It doesn't have to be, oh my gosh, let me hurry up and get this patient done. It's, did I get the best image that I possibly could get on this patient? Did I take the time? It's okay. Another quick thing when it comes to echoes, to help with lung interference. You can have patients take a deep breath in or blow all their air out. Sometimes that can help move the lung out the way so that you can get a better image. But that is going to be it for today. I'm gonna wrap up this video, but please let me know what you want me to talk about next or in upcoming videos. But I think what I might talk about in the next video will probably be circulation. A couple of my students had a slight issue with this, so I will talk about the circulation as it goes through the heart so that you guys can get maybe a better understanding. I don't know, hopefully I can explain it well. But please don't forget to like and subscribe, and leave any questions or comments down below that you will like me to address and or answer. I hope that you have an amazing day, and thank you for watching. I hope you guys stay tuned.